Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, an upcoming telehealth practice dedicated to helping those with chronic pain to live pain free or significantly pain less lives and better quality of life. Today's topic I wanted to share with you is should you get an epidural steroid injection? That's really referring to people who have neck or back pain, and maybe your doctor has suggested it. I want to give you some pros and cons to help you make your decision. First of all, an epidural injection is an injection that is given in the space between the spinal cord and the spinal canal that the cord runs in. There are different types of epidural steroid injections based on the target of where the injection is going, and there are different substances besides steroids that can be injected into that space. So just want to explain there is a variety. We're sticking to that topic today is just on epidural steroid injections in general. And first, a list of the pros. One, it's fast. You're going to be in and out the same day, as opposed to having surgery where, you're going to have many hours of surgery, possibly days to recuperate in the hospital, days of hospitalization, days of recovery, days of rehabilitation, maybe even 2 weeks. So it's fast. It's a fast intervention. It's safe. I know there's sometimes people are worried. Maybe I'll get paralyzed. They'll hit the raw a nerve and I'll have damage. That's very, very, very unlikely because they do it under guidance. They're either under video fluoroscopy guidance or ultrasound guidance, and they're seeing exactly where they're going. So the medication is getting to the target and it's not going anywhere it should not go. And that's another plus to it. If you think about taking pills, your pills is going throughout your whole body through your bloodstream, and some of it's reaching the target. This way, all of the medication is getting to the desired target to work. And the results can be quick in that if you couldn't work before the injection, people are able to go back to work. If you're a plumber, electrician, doctor, you're able to go back and function without pain. They can lower the need for pain medications after getting an epidural injection. It can avoid or at least delay the need for surgery by getting an epidural steroid injection. Um, that's, I guess, pretty much it that I could think of in terms of pros. Something else may come. Cons, there are cons. One is that you cannot do this too frequently. In fact, they space them out generally 90 days apart. Oh, there is another pro. If you have if you have leg pain, if you have arm pain, then it's more likely that an epidural steroid injection will be effective for you as opposed to just having back pain or neck pain. So if the pain is radiating to the leg, it likely is going to help you. Okay. Anyway, getting back to the cons, um, they do have to be done spaced out. Generally, they space them out 90 days or 3 months apart, only 3 injections per certain body part. That is because if you do them too frequently, they can cause bone erosion or thinning of the bones or osteoporosis, which leaves you at risk for bone fractures. So that is one downside or con for getting an epidural steroid injection. If you only have neck pain or back pain, as I said earlier, it's less likely to be effective for you. There are other side effects that are possible. You can have ulcerations from having steroid injections. It can cause your blood sugar to be elevated, and that's particularly a concern if you're diabetic or pre-diabetic. Um, I've known of someone who was not diagnosed with diabetes until after steroid injection. I imagine she was at risk for it, didn't know it, and the steroid kind of pushed her over the edge. Um, other other problems with it. I'm trying to think of the cost if you don't have insurance. Of course, the cost, as far as I'm concerned, has gone down much, much more since when they first started giving them, but it's still in the hundreds of dollars. So, my suggestion is, and then the other thing is its variability of its effectiveness. So no one can tell you for sure 100% this is going to help you. It's possible that the first one doesn't do much, but then you have a second one where you really get a lot of relief, or vice versa. The effectiveness can vary from person to person. So between injections, as well as from person to person, it's very variable in terms of its effectiveness. My suggestion would be is if you get a first one and your pain is 50% less or even better than that, I wouldn't necessarily, when the time comes that you're eligible to get another one, I wouldn't necessarily go get it if you're still feeling much better. Just I say, reason being, sometimes the second one doesn't work as well as the first one, and sometimes people regret, I was feeling good and then my pain came back or whatever. So uh, I I would definitely, if the first time didn't help much, you want to try again, why not? But if the first one helped really well, I would go with that until it's no longer really working. Um, but the thing about the steroid injections, which I think is important, is that it relieves the pain enough to where you can participate in physical therapy, which is ultimately the thing that should get you better. If you can do the exercises, exercise is medicine, just like food is medicine. And if you can get you stronger, get you more flexible, get better range of motion, all those things, that even should the injection wear off, you'll be much better off overall because you were able to do the exercises, which are ultimately the thing that helps you recover and do better. That is all for now. There may be something else that I'm not remembering, but for now, that's it. And I hope that's information you can use. Certainly like us on Facebook, YouTube, Instagram. Visit our website, chronicpainrescue.com. As I said, we'll be soon taking appointments. And so if you think you'd like to work with me, I'd be honored to be a partner with you in helping you to get rid of this chronic pain, so whether pain is not controlling you, but you have control over your pain, um, and just to live a whole life, better life in 2023. Until next time, peace and blessings. See you later.